Millions of Americans have heart conditions that require them to wear implantable pacemakers or defibrillators.
Intermountain Healthcare recently launched a new program that's helping patients with these devices. ABC4's chief medical correspondent Saray Chin reports.
Pacemakers or defibrillators help keep hearts beating at a normal rate or shocks the heart if suddenly their heart experiences problems. Sometimes these implantable devices need to be checked.
When patients come in when they're having chest pain, shortness of breath, they feel their hearts beating a little bit funny, or they collapse, and for no clear reason, patients come in with these devices to any urgent care or emergency room.
Physicians then want to know what's going on and what information the device captured. A company representative would have to physically come into the hospital to assess the device, and patients would then sometimes have to be transferred to a bigger hospital, especially if they live in rural areas.
So that's time, anxiety, a transfer of care that we felt was inappropriate. We want our patients to receive high-level care in the communities that they live in.
Cardiologist Dr. David Min says that's exactly what Intermountain Healthcare has achieved.
We now have the capability of interrogating these devices at all 23 of our hospitals.
Now doctors can read whatever information is on the implantable device with a small wand placed over the device.
And so we'll pair the device, this device with this tablet at this time. Typically this device would be under your skin here. We just place this over here. It detects the device, and then now it's communicating with the device that's under your skin. And so it's able to read, is the programming correct? How is the battery life doing? How are the wires that are connected to this device going into your heart, are they functioning appropriately?
The data then alerts the company who makes the device.
And then immediately contacts the ED to let them know what's going on with that patient.
This new capability is also a huge time saver when it comes to routine checkups, which happen roughly twice a year. Instead of patients having to go to a major facility, they can now go to their local hospital to get checked out in minutes.
Our patients now have the capability, and their providers that are seeing them in the ED, to interrogate, to read this information and understand, was it related to their heart and their device, or was it not? And 96% of the time when patients get this interrogated, their device is working just fine. Okay. And so now their physicians can focus on other things.
In Murray, Saray Chin, ABC4 News.